Quality means that I can stand behind the services provided and know that if it were my family and my loved ones, which do live in the region, I would be happy to receive the services and know that the care is good.
You know, you always think of those catchphrases, but quality is just giving 100%, 110%. People might have said that today already. Might be standard jargon, but quality is giving the most of yourself every day. A lot of the staff across the organization at all three offices really do care, and there are a lot of quality people.
To me, quality means that regardless of the individual that calls into our office or our organization, we give the same level of superior service to that individual. So it doesn't matter who the person is, if it's a community partner or an individual client in the community or a member of parliament. The information that we provide to that person will be the same quality regardless of their background.
We're supporting other agencies and our stakeholders in the community, the hospital, other service providers. And the quality aspect is really getting the best out of everyone.
If we look at healthcare in Ontario, it's rapidly moving towards increasing transparency and accountability. A massive amount of the provincial budget is spent on healthcare each year. I think the public needs to know where that money goes. They want to know that it goes to where their care matters most. They want to know their families will be taken care of, and they want to know that system's going to be there tomorrow for them. I think quality is about providing both an excellent level of quality service, but also demonstrating how we're providing that quality service and where people can find that service.
So really everything we do in terms of the hiring, the recruiting, selecting quality people will translate itself into quality interactions, quality services for our clients. At the end of the day, we exist because of our clients, and everything we do, even in human resources, needs to be client focused.
I think what we do the very best is that our frontline staff are truly dedicated to clients. I hear it day in and day out when issues come to me. It's all about what can we do for this client, how can we do it better, what's currently working isn't, so let's think out of the box. Those are the types of things that make me know that our frontline staff are always thinking about clients.
At Erie St. Clair CCAC, we are committed to providing quality care and assisting clients and their caregivers to accessing services, networking with other community partners, making referrals to those community partners, and providing guidance and support through the client's journey, and also helping those who are new to the healthcare system navigate through that.
For me, I'm a flow case manager, so I work everywhere, I cover everywhere. So I have this privilege of seeing a variety of working setting, and myself as a case manager, I'm very proud to be a member of the organization because I do see what I do every day make a very positive difference in people's life, whether they have surgery in the hospital or they're dying at home. People are very appreciative and they're grateful for the quality of care we provide.
What I do is I teach, educate, promote independence, and enable people to make the proper healthcare choices. I give them the resources that are available to them and promote independence so they feel like they're more in control. And I think that is very important, is if we're all given the knowledge of what is available to us, then we can make the proper choices for ourselves.
Spiritual care for me, I believe everybody has that core of spirituality, and embracing that a person is going through illness, sickness, diagnosis that very disconcerting, that there is an inner strength that needs to be cared for, and as a team I am that part that can sit down and say, how's it going today and what's happening, and build on that faith and strength part of their lives too.
What I do here as a case manager is just one component of a very well-oiled machine. I really see us as almost, an analogy I often use is like we're Santa's elves or we're air traffic controllers. We're not in the foreground. We're often in the background, working very hard to ensure that everything is flowing and functioning the way it has to.
Actually, they love to talk about their experience at the CCAC. They always actually commend the CCAC staff in terms of what they have received, the compassionate care. It really enlivens me as a board member because I guess it shows how much we're needed in the community and how much we touch people's lives on a very personal level, and the fact that we are doing the job that the people need is important to us.
We have a quality team and a quality framework that guides our work and allows us to measure our successes against established targets. We're not perfect. And one might say, well, how do you deliver quality care? Some of it's intuitive, some of it is based on the skills and knowledge that we have and that we bring to the organization from our education, but as well things that we learn on the job. Some of it is driven by what we hear from our patients and families and what we learn from the experience of working with our families together.